Hello, everyone. My name is Maddie Huwe. I'm a member of the Patient Advisory Council, also known as the PAC, and I am a co-chair of the Advocacy Task Force within the PAC. Today, I'm going to give an overview of what the PAC resources are and how they are created, as well as introducing the newest PAC project, the Disordered Eating Toolkit. I'm also going to be presenting some updates regarding what other projects the PAC is currently working on. So resources created by the PAC. One of the valuable aspects of the PAC is the perspective we deliver. We're on the receiving end of care and living in these chronically ill bodies, and we manage our illnesses every single day. We know what it's like to miss school because of a flare, or to place an NG tube, or to be scared to look at lab results. And we also know what it's like to feel alone with those feelings. So this is why we share our experience, so that other patients feeling this way know that they're not alone, and so that our providers can know how to best care for us. So the question becomes, what is the most efficient way for us to deliver this message to our audience? And in many cases, the answer to this question has been toolkits. So what is a toolkit? PAC toolkits are resources developed by IBD patients, and our hope is that by informing providers, researchers, and families, other IBD patients will receive better care and will feel empowered in their own experiences. How is a toolkit created? We choose topics that we feel are important and impactful elements of patient life, from ostomies, body image, and nutrition, to college accommodations and travel, and then most recently, disordered eating and IBD. After a topic is chosen, a toolkit team is established. Normally, a patient is assigned as lead to design, organize, and manage the project, and other PAC members contribute. The patient experience included in the toolkits is provided by PAC members, and PAC members contribute in other ways, such as brainstorming ideas, filling out surveys, and editing the resource. And then one of the amazing things is that in addition to PAC members, several of the resources have the input of professionals from the ICN community. For example, the Nutrition Toolkit collaborated with nutritionists and dietitians, and the Disordered Eating Toolkit partnered with psychosocial fellow and former PAC member, Dr. Jenny David. And then finally, the resources are reviewed and edited by other ICN teams, such as the psychosocial professional team and the communications team before they're released to the community. Okay, so once we get a team established, the content for the toolkit is gathered. The toolkit team develops surveys for both the PAC and any professionals involved. And other content used is gathered at this time as well. For example, in the case of the accommodations toolkit, the toolkit team gathered information about IBD accommodations from credible sources such as the Crohn's and Colitis Foundation website. Once all of the content for the resource is gathered, it can be assembled. So the team of PAC members take the experience, advice, and research, and they put it into a format that is easily accessible to the reader. And that includes adding images and graphs and charts and fun colors. And the final step before the toolkit is released is the editing phase. Both PAC members and members of the ICN community review the resource, and final content is added, and any necessary changes are made. And then finally, after the resource is edited, it can be released to the community to be used. So the current projects the PAC is working on right now are the Lifestyle and IBD Toolkit and the Medical Literacy Toolkit. The Lifestyle and IBD Toolkit is being led by PAC members Becky and Rohit. And if you stick around, you can hear Becky, Chloe, and Quint discuss IBD and lifestyle changes in the next presentation. As the PAC, we want to share what life, both in and out of clinic, looks like for IBD patients. Some of the topics that will be covered in the resource include diet, exercise, treatment, and mental health. Managing and living with IBD means some pretty significant changes in a patient's lifestyle. And things like scheduling and making it to doctor's appointments, taking meds on time, and managing sleep, diet, and exercise are all factors that are a part of a patient's life. And the PAC hopes to highlight what some of these changes are, as well as give providers and patients insights on how to best care for these patients. The Medical Literacy Toolkit is the other resource that PAC is currently working to build. Many patients and families feel very overwhelmed with the immense amount of medical information they're required to process, especially when following a brand new diagnosis. I know that when I was first diagnosed, I didn't even know what the words Crohn's disease were. So the goal of this resource is to provide patients and families with tools to decipher common medical terms, including lab results, symptoms, and procedures. And our hope is to maybe make that initial transition into the new diagnosis a little bit easier, as well as anybody with IBD in general who's trying to navigate the healthcare system. We want to empower patients to take charge of their health by helping to inform them of basic healthcare lingo. So the most recent toolkit developed by the PAC is the Disordered Eating and IBD Toolkit. Disordered eating is something many patients have experienced, yet there are very few resources about it. And this is one of the reasons we decided to develop this toolkit. Living in a chronically ill body is unpredictable, and sometimes this lack of control can lead patients to develop unhealthy thoughts and unhealthy behaviors around food. In addition, therapies involving the restriction of food can lead to food fears and disordered eating patterns. So this resource is composed of both patient experience as well as professional insights. One of the amazing members of our toolkit team is former PAC member Dr. Jenny David. Dr. David is a postdoctoral fellow in GI psychology at Nationwide Children's, and she was an invaluable source of information as we were developing this resource. Her doctoral dissertation focused on assessing the prevalence and risk factors for disordered eating behaviors in adolescents with IBD. Jenny helped us answer questions such as, what is disordered eating? How does it differ from a diagnosable eating disorder? And what can disordered eating thoughts and behaviors look like for an IBD patient? In addition to Jenny's professional experience examining disordered eating in IBD patients, we included PAC members' stories, advice, and experience in the toolkit. Using surveys, we asked PAC members questions like, explain a time when your experience with IBD treatment impacted your eating behaviors, or how do you modify your eating behaviors because of your experience with IBD therapies? And another question we asked was, what IBD-related concerns impact your eating behaviors? And then we created visuals based off of questions such as, does your self-esteem related to your IBD impact your eating behaviors? Or are your eating habits impacted by a desire for control? We also asked PAC members questions about what advice they would give to parents and providers regarding management of disordered eating thoughts and behaviors. And we took all of this information and assembled it into a format that is both easily accessible and organized. So how does this toolkit add value? Well, our hope is that the community will use this resource to better their understanding of how to help and support IBD patients struggling with disordered eating. We aim to shed light on this under-discussed and significant issue. And finally, we hope that the toolkit can be used to help other patients feel less isolated in their experiences. I encourage you to use this resource and any of the other resources on ImproveCareNow's website. You can share it with others, print it out, read it yourself, or use it in clinic. And again, all of these tools are accessible on ImproveCareNow's website.